Now to the coronavirus here in Connecticut. Health officials are watching that brand new COVID-19 variant. We know 2 people in our state have it, but doctors say the vaccine should protect everybody against it. Channel 3 Eyewitness News reporter Courtney Zeller talked with a Yale scientist about how they're keeping track of the newer strain. Courtney?
Well, Mark, this is so fascinating. Researchers are taking random COVID-19 tests. They are positive and using it to test for this strain. Now they want to do more. Yale School of Public Health researchers are ramping up testing efforts after they discovered 2 cases of the UK coronavirus variant in New Haven County.
You know, our group here at the Yale School of Public Health has been doing this genomic sequencing since March. We've been sequencing this virus, around Connecticut, also around the country for quite some time. But now that, some of these novel variants that are of concern are popping up.
The big concern is the second strain is more contagious. Associate research scientist Joseph Favre weighs in.
Because if it is more transmissible, that means there will be more cases. That means there'll be more hospitalizations and ultimately more deaths. So, the public health practices that we've been promoting are more important now than ever.
The 2 people who contracted this second strain traveled out of state. One went to Europe, the other to New York State. The cases are unrelated. In order to test for other strains, Yale researchers get random positive coronavirus tests from labs around the state.
What we get from the DPH and our hospital is we'll get the discarded test. So after they get, you get the swab, it goes in the tube with the media. The folks in the lab will use that to test. But then we take what's left over into our lab, and then we take, so if we know there's SARS-CoV-2 in it, we take that genetic material and we do what's called next generation sequencing, effectively to read the genetic code of SARS-CoV-2.
Doctors say there's really nothing more we can do to prevent it. The current vaccines should work.
The vaccine should still remain effective because it's designed against the entire protein, not just a small part of it.
And scientists say we need to continue to wear the masks, social distance, and wash our hands often. We're live with the mobile newsroom tonight. Courtney Zeller, Channel 3 Eyewitness News.